Hi guys, Dr. Eilbra here. Welcome back to the channel. In this video, we will be talking about an essential vitamin and why you should try to incorporate more of it into your diet and lifestyle because of its massive health benefits for your overall health, and that is vitamin B12. Now, vitamin B12 is also known as the energy vitamin. The scientific name for it is cobalamin, and it is a water-soluble vitamin, and what that means is that it does not have an upper limit intake. So toxicity and overdosing is not a problem with this vitamin because our body gets rid of it through urination. Now, vitamin B12 is responsible for the production of red blood cells, brain and nerve functions, and also creating DNA. So it is a beneficial vitamin to keeping our bodies healthy. Vitamin B12 is measured through a simple blood work that your doctor can order for you. And the normal range for vitamin B12 is 190 to 950 picograms per milliliter. And if your values fall below this normal range, the condition is termed as macrocytic anemia. And the symptoms of macrocytic anemia include headache, dizziness, fatigue, joint pain, abdominal pain. Also, diarrhea can also be seen. And if you experience any of these symptoms, you definitely want to make sure you follow up with your primary care provider and get your vitamin B12 levels checked. Now, vitamin B12 comes in two types of formulations. It comes as a subcutaneous route and also comes as an oral formulation. The subcutaneous route is dosed as 100 to 1,000 micrograms. It could be given daily, it could be given weekly, or it could be given monthly, depending on the severity of the macrocytic anemia. Now, the subcutaneous route of vitamin B12 is a prescription, so you can definitely check with your primary care provider to see if they can order that for you. Or the tablet or the liquid formulation can also be given to patients that have mild to moderate cases of macrocytic anemia. Now, the tablet and liquid formulation can be found over the counter. The tablets can also be ordered as a prescription by your primary care provider. Now, the dosing for the oral formulation is 1,000 to 2,000 micrograms, and this can also be given daily, weekly, or monthly, depending on the severity of the macrocytic anemia. Now, there are certain medications that can deplete vitamin B12 that you should be aware about. And medications such as metformin, which is a diabetic medication, when given in long term, can cause a deficiency in vitamin B12. Certain steroids such as methylprednisolone, dexamethasone, when given long term, can cause a deficiency in vitamin B12. Also, proton pump inhibitors such as Prilosec, which is omeprazole, Nexium, which is esomeprazole, Protonix, which is pantoprazole. These medications are used for acid reflux, and when given in long term, can cause a deficiency of vitamin B12. Also, large consumptions of alcohol can deplete vitamin B12 from the body, so you definitely want to make sure that you keep this in moderation. Now, vitamin B12 is abundant in the foods that we eat, such as liver, beef, chicken, eggs contain vitamin B12. Certain vegetables such as beetroot, butternut squash, mushrooms contain vitamin B12. Fruits such as banana, apple, blueberries, certain nuts such as peanuts and almonds contain vitamin B12. So with that being said, go ahead and try to incorporate more vitamin B12 into your diet and lifestyle. Let me know what your thoughts are down in the comment section below. Thanks, and we'll see you in the next video.